Roadmap to Success and Happiness. Chapter 34. Medical Treatment. The greatest mistake in the treatment of diseases is that there are physicians for the body and physicians for the soul, although the two cannot be separated. For chronic ailments where allopathic treatment does not cure or give relief, it's worthwhile to explore holistic treatments like naturopathy, homeopathy, Ayurveda, acupressure, and acupuncture, as alternate techniques of healing. However, you need to take precautions, making sure of the credentials of the practitioner, and doing a reference check with a few patients. Be careful of drugs given by medical practitioners without a prescription. They often contain steroids, which may be dangerous. You should always ask your doctor for details about your illness, treatment, and medication, and the possible side effects of the medication. You should not feel embarrassed or intimidated to do so. In fact, if your doctor is rude, brusque, or impatient when you do so, you should change your doctor. Even if your doctor provides you with all the information you asked for, you should still get a second and third opinion, especially if you need surgery. You can also check the internet yourself for medical information about your ailment and its treatment. However, you should not attempt to medicate yourself. Human proximity, visibility, and touch result in far better outcomes in doctor-patient relations than cold communications over the internet. The biggest health challenge for most people, especially after the age of 40, is high cholesterol. High cholesterol is caused by poor diet, sedentary lifestyle, and stress, which in turn leads to heart ailments, diabetes, and ulcers. In some cases, they may be hereditary or genetic. A multivitamin, multimineral supplement is recommended by most doctors for those over the age of 40. The other common ailments as one ages are back problems due to excessive sitting and bad sitting postures. You should try to minimize taking medicines. It is important to make sure of the supplier, as the market is flooded with spurious medicines. You should always read the fine print on the packing and the accompanying literature. If you are recommended surgery, you should get several opinions, and consult physicians besides surgeons. It is good to have a doctor as a good friend to consult, on all aspects of medication, health, diet, and nutrition. MRI scanning is beginning to be both a blessing and a curse. It is a blessing because it gives a better view of, and insight into the human body. But it can be a curse because normal wear and tear may result in unnecessary alarm and surgeries, especially by doctors looking to make bucks. This is so, in the case of benign tumors, calcification of various areas of the body, and other glitches that may mean nothing and would have been best kept undetected. A person with a cold, who sneezes without using a handkerchief or tissue, can infect up to 150 people in a commuter train or similar closed environment, as people pick up the germs from the air, handrails, seats, and other surfaces they touch, within 5 minutes of the affected person touching them. To keep colds at bay, what is recommended is, gargle daily with hot or salty hot water before going to bed, avoid excessive stress that strains the body's immune system, and get adequate rest. Getting too little rest weakens the body's immune system and makes it more susceptible to a cold attack. Cold expert, Dr. Jack Gwaltney of the University of Virginia, recommends taking a combination of NSAIDs like aspirin and antihistamines, every 12 hours, even if they cause drowsiness, for 3 to 7 days. You should visit a doctor after a week if the symptoms worsen or don't disappear. You should get more than one opinion for major medical treatments.